welcome to our session on innovations in home health, lessons from COVID-19 and impact on future kidney care. I'm Jennifer Jones, a retired Marine veteran, member of both the AAKP National Board of Directors and Executive Committee and an AAKP National Ambassador. My kidney journey began while deployed to Afghanistan in 2011, and what felt like a blink of an eye, I went from serving as a combat camera videographer to being medically retired in 2013 due to being diagnosed with a rare autoimmune disease called membranoproliferative glomerulonephritis type 1 idiopathic. After starting dialysis, I felt out of control of my life and my situation. I knew I would have to make a conscious decision to take back control of what I could and be my own best advocate. I went on to share my story and found a living organ donor in 2015. Due to rejection, I recently returned to dialysis, but not without hope, faith, and a plan. When I returned to dialysis, I knew immediately I wanted to pursue a home dialysis therapy. I felt home dialysis would give me more control over my life, my schedule, and my health, so I pursued peritoneal dialysis. Additionally, as the coronavirus pandemic continued, with kidney patients being noted by the Centers for Disease Control and Prevention as a group that is at severe risk of complications if they contract the virus, I knew a home therapy was the right choice for me to help me stay home and stay safe. I'm pleased to share that I'm currently on track to receive a kidney from another living donor. I became involved with AAKP because I wanted to join a group of like-minded individuals who were passionate about improving the quality of life for all kidney patients and their caregivers. Who better to understand the needs of the kidney patients than the kidney patients themselves? Being a part of AAKP has allowed me to be a member of the AAKP PERCORI-funded Peer Mentor Project Stakeholder Committee, the Stakeholder 5 Committee with the Scientific Registry of Transplant Recipients, the Black Women's Health Imperative Rare Disease Diversity Coalition, multiple Capitol Hill Advocacy Days, and much more. I would now like to move forward with our session and am pleased to introduce our panel of speakers, which includes Dr. Abi Sundaramoorthy, Executive Vice President of Clinical Enterprise for Somatus. And now I would like to welcome our final session speaker, Dr. Sundaramoorthy.
Hi, my name is Dr. Abi Sundaramoorthy, and I am the Executive Vice President for the Clinical Enterprise here at Somatus. Somatus is the leading provider in value-based care for patients with underlying kidney disease. And our goal is to keep patients healthy at home. I'm here today to talk to you a little bit about the lessons learned from the COVID-19 pandemic that support our mission to improve patient outcomes by keeping them healthy at home. As many of you may know, COVID-19 has had a disproportionate impact on patients with underlying kidney disease. As you can see on this slide, ESKD patients have really suffered from the COVID-19 pandemic, with an infection rate 5 times higher in ESKD patients than in the general population. ESKD patients have experienced a 4 times higher mortality with COVID-19 compared to the general population. More than 85% of patients who receive in-center hemodialysis stated that they were worried to get their hemodialysis treatment due to infection risk with the COVID-19 pandemic. And 60 to 80% higher hospitalization rates were seen in members with underlying ESKD. For CKD patients, which is often underdiagnosed and patients may be unaware that they have underlying kidney disease, we saw an 80% higher rate of requiring mechanical ventilation when a patient had COVID-19 compared to non-CKD patients. We also saw 60% higher mortality rates in these patients compared to non-CKD patients when they became infected with COVID-19. There was a 50% higher hospitalization rate in CKD patients compared to non-CKD patients when they contracted COVID-19. And finally, for those patients who suffered the sequelae of COVID-19 with acute kidney injury and end organ damage, we saw 3.5 times higher rate to start new dialysis. We know that healthcare facilities such as hospitals, nursing homes, and dialysis centers have been hotspots for contracting the virus. So our goal is really to get patients treated as much as possible and get their care in the comfort and safety of their home. However, whilst over 600,000 people died in the United States from the COVID-19 pandemic, what we fail to realize is that every year, over 400,000 patients die in the US healthcare system due to other acquired conditions and other deadly infections. These are oftentimes contracted in the hospital setting, in nursing homes, in dialysis centers, and many other healthcare facilities. So reality is we have a pre-existing national emergency that COVID has given us the impetus to solve. The good news is we've already created many of the tools that are going to help us solve this problem. Here are some tools that the healthcare industry has already started to work on to improve the care of patients at home and prevent them from being needed to get admitted to a hospital or other facilities, such as nursing homes, in-center dialysis. One important tool is telehealth. Telehealth is a highly underutilized tool, which can give access for patients who require other caregiver support or have other barriers to healthcare, can give them the opportunity to get healthcare within their home. It can also give rural patients a setting in which to speak to their provider virtually without having to go into an office. However, despite the US's advancements in technology, there are nations in Europe that have far exceeded our utilization of telehealth services. As you can see here, telehealth improves outcomes and costs in nephrology patients, specifically in dialysis patients. We've seen reduction in overall hospital days and subsequent reduction in hospital costs, as well as reduction in ED visits when these patients have access to a provider or healthcare services virtually. Other key tools that can be utilized to keep patients at home include things such as home health services and care management services, which really focus on preventative care and care management throughout chronic disease within the home. The US per capita healthcare spending is almost twice the average of any other wealthy country, and yet most of that spend is on admin costs, but less on long-term healthcare. We really need to move our focus to long-term healthcare initiatives such as home health and care management that can be provided in the home setting. As you can see, home health improves both quality and cost outcomes for patients. For example, home health services after ER visits have reduced hospital readmissions by up to 28%. And home health services after ER visits have significantly reduced medical costs by 36%. Home health services associated with reduced ER visits by 25%, specifically amongst the kidney care and urology patients. Another key important tool is care management, which also offers high quality, low cost outcomes. Somatus, as a care management company, has reap the fruits of many of these outcomes. In our care management program, we have seen a reduction in inpatient utilization for members who are engaged in our home program by 34%, and a reduction in readmissions after discharge in our engaged members by 30%. Overall, we've seen an improvement in home dialysis starts for our home engaged patients by 85%. Our Somatus care team does this through a multidisciplinary approach that includes RN care managers who facilitate coordination of care with primary care providers, with specialists, post-discharge, and with our referral system to our ancillary services. Our clinical pharmacists do medication reconciliations and medication reviews for each and every one of our engaged patients, as well as looking through pill boxes in the home and helping patients organize their day and how they take their medications. Our renal dietitians are highly trained on the right type of diet, whether that's the DASH diet for hypertension, the diabetic diet, the low sodium diet for heart failure patients. They're able to look in our patients' refrigerators and help them with grocery shopping and lifestyle modifications while caring for these patients in the home. Our social workers are able to look at our home environment and ensure patients have the right DME supplies, as well as the right psychosocial support systems. Our community health workers work with our patients in the home, as well as community resources, to ensure that patients understand what their health plan benefits are, and those are delivered to the home, as well as what is available in their community, whether that's medication affordability, food and shelter support, food insecurity, coupons, transportation, amongst many other resources that may be needed. And finally, our nurse practitioners do home visits, which can be facilitated through telehealth to engage the patient's providers, as well as understand what the home environment might be and what patients' physical symptoms are to help them manage their symptoms within the home and engage their provider when needed. Luckily, COVID has significantly increased the utilization of some of these key tools to help our patients stay healthy at home. One specific use case has been telehealth. With the COVID pandemic, the United States has really increased the utilization of telehealth services by up to 30 times as much as we were pre-pandemic, with nephrology being the fourth highest medical specialty using telemedicine. Use of telehealth services, home care services, and care management services have helped increase home dialysis for our dialysis patients and ultimately improve outcomes during this pandemic. As you can see here, for patients who received home dialysis, they had 2.5 times lower infection rates of COVID compared to those patients who were receiving in-center hemodialysis. These patients also had 3 to 4 times fewer hospitalizations compared to in-center patients during the pandemic. And finally, for home dialysis patients who did end up getting COVID-19, they had a 50% lower risk of mortality compared to those patients who were undergoing in-center hemodialysis. In the spirit of not wasting a crisis, we need to look forward to moving from curing disease to keeping patients healthy at home. And in order to do this, it will require an entire community, an entire industry, and an entire society to change. This includes changes in our regulatory environment to support the use of telehealth services, home care, and care management in the home, changes in policies, procedures, and strategies in the healthcare industry, and changes in reimbursement to support our providers who are moving care into the home. Finally, it will require the empowerment of every provider and every patient, since moving care into the home is the future of kidney care. Thank you for your time today and your dedication to our patients.
Thank you, Dr. Sundaramoorthy. If you would like to learn more about home dialysis options, please visit the AAKP website at www.aakp.org and click on the Education and Resources box at the bottom of the home page, or check out additional information under the Center for Patient Research and Education tab by selecting Dialysis. You can also find the latest COVID-19 information impacting kidney patients by clicking on the red Coronavirus Information button at the top of the AAKP website. Again, we thank all of today's speakers and thank you again for joining us.